5 million Victorians will be required to mask up today or face hefty fines as the state desperately tries to control its coronavirus outbreak. The mandatory rule came into effect at midnight across Melbourne and Mitchell shire. Authorities hope the measure will cut case numbers and help prevent another horror spike like yesterday when Australia saw its biggest daily increase since the pandemic began, with Victoria recording 484 new cases.
New South Wales officials are also closely monitoring clusters there as the case numbers creep up. The economic impact of the pandemic will be outlined later this morning when the Treasurer releases the much anticipated mid-year economic update. The budget deficit is reported to blow out to almost $90 billion, the biggest since World War II. We'll have more on that shortly, but first, Elias Clure in Melbourne CBD and Jessie Dorset outside the Ashfield Baptist Aged Care Home in Sydney's Inner West join us. First to you, Elias. Melburnians now have to wear masks. Are they following those rules this morning?
Yeah, well, I haven't seen anyone here at Southern Cross Station not wear a mask as of midnight this morning. If you're not wearing a mask, it's a $200 fine. Now, I've spoken to a few people here this morning as well, and they say that this rule, they believe, is a little bit overdue and they feel a lot safer now that everyone's wearing them. Now, this rule was introduced after Brett Sutton told the Premier that he'd looked at the data, particularly in the United States, and determined that people wearing masks reduces community transmission, which is particularly critical now given that Victoria recorded another record daily increase yesterday of 484 new infections. There's over 200 people in hospital and 40 in intensive care. And aged care continues to be a particular concern to authorities, with over 40 separate clusters, and the cluster at St Basil's in Fawkner growing by 18 yesterday.
To Jessie Dorset in Sydney now. Jessie, a staff member tested positive at that Ashfield Baptist Aged Care Home. What are the concerns now for residents and other staff?
Michael, all residents and staff are being tested after the staff member contracted coronavirus. They dined at the Thai Rock restaurant in Western Sydney. There's a growing cluster of cases connected to that venue. It now stands at least 37. The worker did 3 shifts after they were at the restaurant, but the Ashfield Baptist Homes tells us they weren't symptomatic at the time, and New South Wales Health believes the risk to everyone here is very low. Nonetheless, extra resources have been brought into the facility and most visitors won't be allowed in until at least the end of the month. Let's move further up the coast now to Port Stephens, just north of Newcastle, the situation there. And there have been another 3 infections in that district, including a student at the Tomaree Public School. That primary campus plus the nearby Tomaree High School will be shut today for deep cleaning, as will the Good Start Anna Bay Childcare Centre. Those new infections will be included in today's figures. Yesterday, we learned that a 60-year-old man from Port Stephens tested positive as part of that same Thai Rock restaurant outbreak. Michael, everyone in the Hunter district is being told to be on high alert for any symptoms of COVID-19.
Good advice. Back to you, Elias. Many people watching this morning might be asking, what is a valid question? Why you're not wearing a mask?
Well, it's funny they should ask, and that's because an exemption has been granted to broadcasters doing live crosses, and that's for our deaf and hard of hearing viewers. It's so they can see our mouths, but rest assured I'll be popping this on as soon as this live cross is done and we're off air. Now, there's other exemptions as well for children under 12 and people with a medical condition who provide a note saying that they cannot wear a mask. But police have said they will exercise discretion in the first 7 days, but they want people to try their best and that you don't have to wear a mask. You can wear a hanky, a bandana or a scarf, just anything covering your mouth. Michael?
Elias Clure, Jessie Dorset, thank you so much. And I should point out that same rule applies to Lisa and I here in the Melbourne studio of News Breakfast. The minute we're out of the studio, the masks come on. More than 15 million cases of coronavirus have now been reported worldwide, less than a month since we crossed the 10 million mark. The US remains the country with the most cases at nearly 4 million, and California has now overtaken New York as the worst hit state there. Brazil is second with more than 2 million cases, and India now has more than 1 million cases as southern cities fast emerge as new hotspots. Victoria is reeling after a record number of new cases were recorded yesterday, raising questions about the effectiveness of lockdown Mark 2. We're joined now by the director of the Doherty Institute for Infection and Immunity, Sharon Lewin. Sharon, good morning to you.
Good morning, Michael.
What's your assessment as to how the growth in infections in Melbourne is tracking?
Well, it's really worrying. Seeing 484 cases yesterday was a surprise to me. And if you look at the trends over the last 2 weeks since we went into lockdown, this number of cases are slowly increasing. Now, they're not increasing at a great rate that we would see with absolutely no intervention, but the trend is not going the right way currently.
What is needed to try to flatten that curve, I guess, once again?
Well, we've got a lot of restrictions now here in stage 3 lockdown. What's needed, I think, is ownership of the problem by every Victorian. We heard yesterday an incredible figure of 9 out of 10 people that have a test don't go home and isolate until they get the result. That is so important. If you go and get a test, you need to think of yourself as infectious until you get a negative result. And we also heard about 50% of people that have symptoms wait a few days before they get a test. And both of those factors are hugely important because they will drive ongoing transmission. 15% of people have absolutely no symptoms and they'll still be infectious.
We've seen very high numbers, sadly, in Melbourne for at least a few days. What's your assessment, Sharon Lewin, of where we go next if, in the worst-case scenario, those numbers keep growing in the next 24, 48, 72 hours? Tougher restrictions inevitable on that front?
Well, of course, we've introduced masks as of today, which are mandatory for everyone who's outside their home, except if you have a medical reason for not wearing a mask, or as we heard about broadcasting not wearing a mask. They may well have an impact on the numbers, but we won't see that for at least 5 to 7 days. I think if the numbers keep increasing, I suspect the government will have no option but to harden restrictions, which would be, a great impost on the state economically. We know that people that are locked in their homes have greater increase of mental health issues, domestic violence. We want to try and avoid a really hard lockdown, but the government may have no choice. I
want to get your views as an expert, Sharon, on what clearly is a passionate debate about joggers. You might have seen reports this morning in The Age. Two prominent experts, Mary Louise McLaws at University of New South Wales and Nigel McMillan at Griffith University, arguing that joggers should not be exempt from the mask rule in Melbourne because they expel breath at a much faster rate than most of the rest of us. What's your view? Should joggers have to wear masks?
Yeah, I was a bit surprised to see that exemption specifically. I don't think there's been hard evidence assessing joggers particularly, but the reasons that you outline make sense. I think it's best to have public health measures that are really simple rule, like wearing a mask all the time when you're outside the house, no matter what you're doing, is a much easier rule for people to stick by.
OK, so joggers, in your view, should whack on the mask?
I hate to say that because I am a jogger, but and it will be very inconvenient. But, you wear a cloth mask and I think that would be fine.
OK, Sharon Lewin, always great to speak to you. Thank you so much for joining us on News Breakfast this morning.
Pleasure. Thanks very much, Michael.
OK, let's get more now on how the pandemic has affected local business, especially this second lockdown in Victoria. Madeline now joins us from Chapel Street in Melbourne. Madeline, take it away.
Yes, Michael, good morning from the lockdown streets of Melbourne today, where some businesses have locked up, in this case permanently. We are, as you say, here at Chapel Street. This was one of the most emblematic and well-known shopping districts in all of Australia, really. But take a look at this. We just have shop after shop empty, and this is really symbolic of the challenge that is facing the Treasurer today as he outlines the budgetary situation and the challenges facing the country going forward. Let's get some business perspective on this. We can speak to Matt Lanigan. He owns Lucky Penny, which is a photography studio, restaurant and cafe. Now, Matt, unlike your fellow other Chapel Street traders here, you actually are open, but just by the skin of your teeth.
Yeah, thanks, Madeline. Yeah, we're in full survival mode at the moment, again, lockdown 2.0. We have a takeaway window on the street, which is pretty much keeping the community connected with a coffee and a snack and a little chat every day. And we also have an online grocery store.
And you're on JobKeeper. If it weren't for JobKeeper, would you still be alive?
JobKeeper is definitely our lifeline. that with the cooperation from our landlord with some rental assistance. Without those two things, our doors will be shut for sure.
Now, we're expecting to hear an outline from the Treasurer today about a collapse in company tax revenue. We're also going to see a projection of collapse in business investment. Given that you're hanging on by the skin of your teeth, I presume you're not paying any tax. What about investment? Do you have any idea about how things are looking for the future?
I guess it's so uncertain that any kind of investment would be high risk right now. That's not to say that we wouldn't perhaps consider it, depending on how that investment option looked. But yeah, like putting money in at the moment is kind of the last thing we want to try and get out of the hole we're in.
Jobs is going to be one of the key things going forward. The government says that it wants to continue with that flexibility in industrial relations and jobs conditions. If that happens, would that enable you to continue employing people?
Yeah, I think definitely, you know, people want to get back to work, just for their mind as well as, you know, the financial side. So yeah, flexibility around employment agreements would be amazing, especially, you know, we had 13 staff and now we have 6 or 7. Yeah.
And just finally, we heard from Labor there that they say that they want a plan going forward. That's not what we expect the Treasurer to outline today, but just coming from a small business perspective, what would help you continue?
Well, I think seeing Victoria's, you know, probably about 3 months behind now, due to a few poor decisions and being delayed, maybe if we could have some extra kind of special consideration and some extra support from the federal government. I know they've said that they may not get us out of the hole, but yeah, it might be nice, yeah. Okay,
all right, Matt, good luck. Thank you very much for speaking to us today.
Thanks, Madeline.
Michael and Lisa, what Matt's asking for there is something that the government has essentially said that they're not going to deliver. They say no special rules for Victoria at this stage or for special sectors, that the measures that they've put in place in order to support the economy are going to be enough. You've got to remember that Victoria is a quarter of this nation's GDP, and we're expecting that GDP to plummet this year. And the projections that Josh Frydenberg was going to give today have really all been calculated, again, very hastily because of what we're seeing in Victoria at the moment. So we're expecting projections for last financial year and this financial year only, because it's simply too difficult to predict what's going to happen much before that,
Madeline,
much after that.
thank you.